Last month, the Royal Inland Hospital in Kamloops was hit with a C. difficile outbreak. The infection is fairly common in hospitals, with hundreds of confirmed cases across Canada every year. On today's To Your Health, Hansen has more on how Northern Health, with the help of the public, is constantly working to keep the illness at bay.
And now, To Your Health, brought to you by Evergreen Pharmacy and Heart Drugs.
It is everywhere. The air, the dirt, and even in some people's intestines. C. difficile is a bacteria that produces a toxin that can cause diarrhea and, in some cases, serious illness.
It can cause mild to severe diarrhea, intestinal inflammation, and in severe cases can lead to death. It's the most common cause of infectious diarrhea in long-term care facilities and the hospital.
For those on antibiotics or who have a compromised immune system, chances of getting C. difficile are higher, and the bug typically shows up in extended care or hospital settings.
What happens is when someone has C. diff, the bacteria or the spores in their feces can contaminate the environment, like taps, counters, toilets, or doorknobs if hands weren't washed. And you can acquire it and become infected by having touched that contaminated surface and then touching your mouth or your food.
Healthcare workers can also transmit the organism through touch or instruments. The spore has a very long life and can stay on surfaces for weeks. Plus, it can be immune to regular cleaning products. The best way to fight against C. difficile is by proper hand washing, whether it be with soap and water or with hand sanitizer. And that applies not only to healthcare workers, but to those who visit patients at the hospital.
We have a number of ways to protect people. We try and make sure that people are not unnecessarily on antibiotics. Anyone who has diarrhea is placed in a private room. They are put on precautions, which means the staff and the visitors that come into that person's room must wear gowns and gloves and, of course, do good hand hygiene.
Northern Health is constantly monitoring C. difficile in both the hospital and other care areas. If an outbreak is noted, housekeeping has additional protocols to hopefully stop the spread of the bacteria. To Your Health, Hansen, CKPG News.